Welcome to a presentation about the Raphael PMR, the personal medical record for you and your entire family. Welcome. Raphael is the guardian angel of health. The application of Raphael is provided to allow you to maintain shareable medical records for all members of your family. When you first load the Raphael PMR and start it up, you'll be asked to provide a number of information. Primarily, username, password, confirm that password, a security question, and then answer that security question, and your birth date. Once you've done that, click the Set Password, and your password and username are set. You won't need to do this again, but you will need to enter your username and password every time that you launch the PMR. Once you do that, you'll see the chart rack. The chart rack has a list of all patients. It's sorted by first name, last name, age, gender, and last modified. You can add individual users one at a time and buy more users one at a time. You also have the ability to add a 4-pack, purchase that within the application, or you can purchase the family pack, which is unlimited number of users. You also have the ability to restore purchases, delete users, and at the bottom you'll be able to purchase the upgrade to PMR Plus. PMR Plus will include things like reminders for medical appointments, tests, or scheduled medications. We're also hoping to include in future modules specific conditions. We'll get to this in a little bit. This is the demographics module for the PMR. Let's go and explore this a little bit. Typically it's used in the landscape mode, so you're going to tip your iPad to the side, and you'll notice that on the left side are our patients, and on the right side is the information as listed. Let's explore a little bit of that information. You'll notice that on the right side there are a number of tabs under demographics, and we've expanded that out. The 5 tabs are patient information, phones and addresses, emergency contacts, legal status, and insurance. Let's explore that one at a time. Under patient information, you'll notice that the date at the top is automatically generated. You'll have spaces for first and last names, birth date with a pop-up for a calendar, age, a slider for gender, ethnicity, there'll be a pop-up, but you can also enter anything you wish in there, social security numbers, driver's license number, email, and then an area for a photograph that can be brought from the photo gallery, the iCloud, or from the camera itself directly, and a notes section. Under the phone tab, it's just like in the contacts in the iPad itself. You have a space for the phone number, and to the right, a pop-up for whether it's mobile, work, home, or other. And the same thing for email and address. These can all also be brought up from the address book itself. Any of this information can be changed at any time or added to, and at the bottom you'll notice that there's a section for comments. Under emergency contacts, you'll have a place for a primary and a secondary contact. The contacts' names can be brought up from the address book, and their relationship to you or to the patient should be included. The information can be brought out again from the address book within, or the contact book in the iPad, and at the bottom is a text area for information that you wish to provide. Legal issues covers things such as resuscitations during emergencies, whether it's a full code or medicines without resuscitation, power of attorney, whether there is one or isn't one, who has it, their name and address or phone number, whether there's to be an autopsy or not, if there's a living will or not, if the patient is willing to donate organs at that time. The insurance tab allows us to place in multiple insurers, primary, secondary, and so forth. These can be added into the spaces provided. If they're in your contact book, it'll also be uploadable. You'll notice that as we've gone through this, by clicking on each one of the tabs on the right, we're able to expand them into the blue areas, which gives us detailed information. Feel free to explore this as we're going through the demonstration. Again, still in landscape mode, we're looking at the patient's medical information. This is that secondary group at the bottom. You'll notice, again, we're in landscape mode, much like the chart rack. We'll be able to click on the users at the left. If we have multiple users, we can click on individuals. And again, the information will populate on the right side. In the medical tab, medical information, the basic medical information is always required. Age, height, weight, blood type, RH factor. You'll notice that body surface area and BMI are blank. Those are calculated on the information that's provided. There's an area for immunization history, diets, and notes. Under immunization, if you click the add button, a pop-up will pop out, and it'll have an area for type of immunization, date received or whether it's approximate, and manufacturer, also if known. There are pop-ups next to each one of these that give types, such as here, hepatitis A or B, HPV, influenza. Once you've done that, you click the Done button and it's entered into the history for that patient. Allergies are another very important component here. Here we're looking for the allergy types, the dates received, whether it's approximate, age, again. You can add reactions with notes, and at the bottom you see the green Add button. This allows us to add multiple allergies. Let's go into that just a little bit. Once you click the blue Add button, a reaction is brought up. Asthma, hives, nausea. The reactions are just as important as anything else. We also want to know where it happens, whether it's skin, lungs, eyes, gastrointestinal areas. If it doesn't exist in the list, you can write it in. Once you've done this, you can add multiples of these. The time of the reaction is almost as important. We want to know when this happened and also how long it took to respond. Here you're going to be able to add whether seconds, minutes, hours, days, months, years, so forth. Once you've done that, you're going to hit you're going to then add in a numerical value, and that will allow you to quantify what the reactions were to these allergens. We can add multiples by clicking the Add button at the bottom there and aggregate multiple allergies and reactions to specific things. Medicines, again, mostly the same sort of thing. We can add the date that it was added, the name, the dosage, units, the route it was taken, the days in use, and also the timing, whether it was morning, noon, or night. You'll see here that we have space for multiples of all these things. This is just like any other PMR or medical charting situation where we can have multiples of any of these things. Frequency, routes, all these things are displayed under medications and allergies. Within medicines, we can also see things like making them inactive at the bottom here or clear them entirely. One of the unique features of the Raphael PMR, though, is the ability to email to doctor. If you have a question about a medication or you want it refilled, you can generate an email that will contact the doctor and have him create a refill for you. We're going to take a look at this. These are basically what they look like, the report on the left and the email on the right. Let's explore this just a little bit. Once you click the email to doctor, a report will be generated with the patient information, their age, name, gender, birth date, and the medications that we want either refilled or in question. At the lower left, you'll notice that there's an email button. Once you click that, it'll generate an email, just like any other email in your iPad, with the information for the doctor, a small paragraph about what's there, which you can add to, and an encapsulated, password-protected PDF of the report that we just saw moments ago. That password that was generated for that PDF will be sent as a second email to the addressee on the email. Under the Physicians tab, it's important that we put in all the information about the physician. Their name, of course, if you have this in your address book, this can be brought in automatically. The relationship, what kind of a doctor this is, whether it's a primary care, attending, resident, intern. Their specialty, if it's known, his email, and then their address. There are notes at the bottom, again, as always. Once this information is entered in, the information about the doctor can be then used for other things within the program. Pharmacies are basically the same kind of setup. We can put in the pharmacy name. If that's in the address book, that can be added directly, whether this is a contact pharmacy or not. And we can add multiples by clicking the Add button in green below the name and adding it to the box on the bottom. We can add as many as we need. There are no need to worry about this, and you can add as many as you wish. Let's move on to past medical histories. Here we see things like personal history, family history, surgeries, previous tests, and in future we hope to include things like injuries from accidents and implants, whether they're cosmetic or medical. Under personal histories, you'll click the plus button and it'll note a complaint. Here we can put things in like abdominal pain, alcohol abuse, anemia, asthma, and we can aggregate multiples of these. Here we're looking at things like arthritis, what characteristics we're looking at, where the location, the duration, the intensity, the exacerbation elements, and the relief elements, as well as social impact, whether it caused you interference during your daily life or not at all. And again, at the bottom, almost as importantly, comments for anything else. Surgical history is exactly the same sort of thing. Clicking the add button at the blue add button at the top allows us to bring up a screen, say, of an appendectomy. The location, of course, we know where that is. Procedure, when the surgery was done, or an approximate date. Say it was a surgery you had as a child and you don't remember the exact date. Your age, or the patient's age. The reason it was done, whether there was an emergent need or not, and the physician who did it, if you know it. And again, any information that can be added to it can be added in notes. Previous tests can be added, such as lab tests, radiological exams, electrocardiograms, and stress tests. These can all be added, and again, we're looking for the test performed, where it was done if possible, the date if possible, and the results. These can also be sorted in the lower box, which is very helpful for doctors. A unique part of the PMR is the ability to ask your doctor questions. Here you can take a photograph or ask multiple questions to the doctor and send these to him. Another feature is on many of the pages that we've looked at is a button at the bottom that allows us to generate a report. The report's very similar to what we had before with medications, in which it's PDF generated and password protected. But you'll notice that when you click the report button in this window, the pop-up gives us a checkoff list. We can check the pieces of the screen that we wish to send to the doctor in the report or the healthcare provider. This will then generate a report with the report generated attached to the email, and a secondary email with the password will be generated automatically and sent to the emailee. In the future, we hope to get back to what we were talking about before. We're going to release updates that will allow you to provide the ability to schedule appointments, tests, and medications from the integrated calendar function built into the program. We also want to develop modules for specific common disorders such as diabetes and asthma, but also more complicated disorders such as hereditary angioedema and psoriasis. We look to you, our customer, and our users to give us feedback at all points. If there's a piece that's missing, please let us know. If there's a module you'd like to see or a feature you'd like to see, please let us know. If something doesn't function, we want to know that as well. You can follow us on Twitter, and you can also just send us a note from within the PDR. We appreciate that. Thank you, and this has been a presentation about the Raphael PMR, the personal medical record for you and your entire family.